All righty. All right. Okay, so good afternoon. Welcome to our second webinar of this year. Thank you all for joining us today. My name is Tanya Finan. I serve as the VP of Education for the HIMSS Arizona chapter. My role basically is to make sure that we are bringing educational topics and information to our community members and sharing best practices within health IT. So I hope you're ready to learn about how conversational automation is enabling meaningful and intelligent conversations between providers and consumers. I was able to get a preview of what is going to be presented today, and I'm super excited to have Rebecca here with the Arizona chapter today and share her insight with all of you. So before we get started, I would like to thank our featured sponsors. We are very thankful for their support and allow us to support our community and bring meaningful content and events to our members here in the Valley. So if this is your first time joining us, HIMSS here in Arizona, a little background on who we are. HIMSS was founded in 1961, and we are a local nonprofit, independent, voluntary association of individuals that promote and continual improvement of hospital management systems through our organized programs. Our vision is to realize the full health potential of every human everywhere and reform the global health ecosystem through the power of information and technology. So here are some of our upcoming events. I really want to focus on a couple. We have our next one actually is on May 5th, Behavioral Health Innovation Panel at Tempe Mission Palms. This is an in-person event from 5 to 8:30. Something you don't want to miss, please visit our website so you can register. You will need to register for that. And also our annual health summit has been locked in. Don't miss that on October 14th. Information on that event will start to be coming out on our website as it comes in, but I do have a preview for you if you want to go to the next slide. We do have some keynotes committed. We have Allison Schmidt, Olympic gold medal and behavioral health advocate, and Steve Brogan, he's a ventriloquist and entertainer. So don't miss that event for sure. Make sure you check out our website. Just a couple reminders for all of you. You have been muted for this webinar, so we can allow our speaker to get through obviously all of the information that she's going to share. We will be taking questions at the end of the presentation, so feel free to type in your questions in the chat box below, and I will make sure that I deliver those questions at the end. We also are recording this presentation today, and it will be posted on our website as soon as that a recording becomes available. So, and it'll be linked to our YouTube channel as well. If you are joining us, you do qualify to earn CE hours for CP HIMSS or CA HIMSS. So please log on to the HIMSS website accordingly so you can claim those credits. And all right, so let me introduce you to our speaker, Rebecca Clyde. She's the CEO and co-founder of Botco.ai. Rebecca has over 20 years of experience in digital marketing in the technology industry. She holds a MBA from ASU and previously was marketing manager at Intel. So she's going to share with you her experience that led her to the creation of Botco, offering intelligent chat nurturing solution for healthcare enterprises. So Rebecca, I will go ahead and turn it over to you.
Great, thank you, Tanya, and thanks everybody for being here with me today. I'd love to hear your questions. So as I'm going through the content, if there's anything that you'd like me to delve into a little bit more, please feel free to just put your question in the chat. So let me tell you a little bit about my story and how I ended up doing a startup today that is focused on patient engagement and AI, especially around being able to answer healthcare related questions. So this is a photo of my daughter that you're seeing. Her name is Mia. And when she was 4 years old, she had her very first asthma attack. So prior to that, I had never experienced anything quite like it with any of my other children. And so you can imagine it was a very disconcerting night. I had to take her to the hospital in the middle of the night. She couldn't breathe. She was gasping for air. Of course, when we arrived at the hospital at Phoenix Children's, everybody, rallied, got around her. They took care of her. But that was really the beginning of this very, very long journey of mine and my family's with the health system in a way that we had never really had to interact. This asthma attack resulted in some follow-up treatment, in some follow-up appointments that the doctors really wanted to monitor her condition and make sure that she was getting treated properly. And so all of a sudden I was thrust into a world of constantly having to call and make appointments and get medications refilled, get all kinds of analyses and testing done on my daughter that I had never been really subjected to. Now keep in mind that I was doing this while also raising 2 other children and running a business and being very involved in my community. So it's not like I have this open schedule to now deal with this in my life. What I discovered, like a lot of other parents that go through something like this, is that we have to slot these things into our daily life. And unfortunately, what I learned through that process was that the health system was not very easy to deal with. I was all of a sudden realizing that I was spending hours of my day on the phone, having to schedule appointments. On a good call, I might only have to be on the phone 30 to 40 minutes. Sometimes I was on the phone 2 hours, just trying to make appointments or get follow-up information, get instructions. And so you can imagine my frustration that started to result through this time. And I felt like, hey, I'm pretty lucky here. I run my own business. I actually have a lot of flexibility in my schedule. And I could barely keep up with the difficulty of interacting with the health system because it seemed to be so driven by other people, like by the system, and not at all by perhaps, what was realistic to me. And as I was going through this process, I started to talk to other parents and actually learned that because I was lucky enough to have flexibility in my own schedule, my child was getting better treatment than maybe some other parents whose moms maybe had more of a blue collar type of job, who only had 20 to 30 minute breaks during the day. And they couldn't get through to make the appointments that they needed because the hold times were longer than their breaks. And so this started to make me think about, how are those families handling these situations? And how are we really setting ourselves up in the healthcare world to support families that maybe don't have all day to sit on the phone and to, wait on hold while things get figured out. So that actually leads me to my first polling question, which is, I'd love to get everybody's input here today. Depending on what organization you work for, what do you feel like more closely resembles your patient contact center? Are you hiring a bank of operators that are sitting at the phone and answering phone lines like you see in this photo here? Or are you using some of these more modern agentless solutions like the one that you see on B? So I'd love everybody's vote here for a second and get an idea of where your organizations are in this continuum. And I know it's a little bit exaggerated, but that's part of the fun. So I'll give you a minute here if you can vote.
They're coming in.
Okay, good.
50% participated so far. So
right.
Give it. All right. I'm going to end the poll.
Okay, let's see what the result is, because I have another poll question after this one. So keep your polling pens out.
Let me share the results.
Let's see the result.
Is it sharing?
So I can see the results. Option A looks about 40%.
Mm-hmm.
The respondents here said they look more like option A, and option B is closer to 60. So that's 38 and 63 to be exact is the breakdown. Yep. That's awesome. So I'm actually happy to hear that we're getting a lot more that are closer to option B. That's very, very encouraging. So congratulations to you. And for those who are maybe looking a little bit more like option A still, hopefully some of the things that we've talked about here that we're talking about here today will give you some ideas of how to move that more on to the option B side. And then also for the ones who are using option B, what I would like to do is today be able to give you insights on how you can be using some of the more advanced capabilities in conversational AI to get the most advantage out of that investment. So good. Thank you for participating and humoring me with that. All right, let's go to the next poll. For those of you who are taking calls at all from your patients, whether it's either over live chat or over a traditional phone line, what is the average hold time? Like, what does that queue look like? Is it a 5-minute queue, 5 to 10 minutes, 10 to 20 minutes, or greater than 20 minutes, or do we not know? Which is also quite possible. It's been changing a lot lately, so it could be that you haven't heard the latest. So I'll give you a minute to respond here as well. I feel like I should have Jeopardy music playing.
Yeah,
a soundtrack.
all right. I
Okay.
think, okay, so I'm going to end the poll. Let me share the results.
Great, thank you. So we have about 20% are saying less than 5 minutes, 50% saying 5 to 10 minutes, 20% saying 10 to 20 minutes, 10% saying more than 20 minutes, and 20% saying no clue. So did that add up to 100? Or is that more than 100?
24.
Anyway.
Oh, it is more than 100.
All right. Well, that's okay. So some people voted multiple times. That's great. All right. Well, just to give you a sense of why I asked this question, not everybody realizes that the amount of time that a consumer is willing to wait without becoming upset or for it to start to detrimentally affect the relationship is 3 minutes. However, most health systems are averaging about 13 minutes right now, and that's on a good day. During COVID, we were seeing 1 to 2 hour waits being very normal for a lot of folks. And again, it also depends what time of day you call, and there's a lot of variation here. But I wanted to include this data because you can see here on the chart where this is a call abandonment graph here on the right, that you can see that right around the 2 to 3 minute mark, you start to experience some significant abandonment rates. And so if you're making people wait more than 3 or 4 minutes, you're actually losing callers at that point. And if you're making them wait any more than 5 minutes, you're going to have less than 20% of your callers actually completing the call. And the reason why this is important to understand is that if for a lot of health systems, getting that appointment is the key to generating revenue. So for either 2 reasons, whether you're an appointment-driven system that collects revenue through insurance, so you need people to have the appointment, the encounter has to happen in order to collect insurance payments. Or if you're a value-based care provider, even more so, you need to make sure that those folks are getting seen and getting the care that they need so that the outcome in your patient panel is such that you get the reimbursement or you get the compensation that your health system needs. So there's definitely a business outcome that is very, very much tied to this data point right here. And so if you're making people wait on hold, but you're only talking to about 20% of the folks that you're trying to reach because you're making them wait on hold, that's a huge gap in terms of revenue that you could be generating for your business. Now, what have been some of the big drivers of this number? COVID had a huge impact in the last couple of years, of course, it goes without saying, but I wanted to call out the impact that COVID has had on women specifically. And the reason why I mention women is because we tend to be the primary chief medical officers of our families. And I did not realize this as much until I started to interview a lot of executives at health systems that are handling the calls and asking, who is usually making the phone calls? Who are you talking to on the phone? And, in some industries or some practice areas, it can be upward of 70 to 80% of the time. It's the mom, the daughter, maybe the elder daughter, if there's an elderly member of the family involved, or if it's children, it's usually the mom that's making these health appointments. And so what has happened is women have actually been, really, really time crunched during COVID. They started seeing less help in terms of childcare. Schools were closing. Their parents were having to get pulled out of nursing homes and coming home to take care of them. So women got the overwhelming burden of this whole issue during the pandemic. And so that's why a lot of women have dropped out of the workforce. We're seeing the lowest participation rate in women right now, which means that now the health systems that employed a lot of these women are struggling as well. So, I don't need to tell anybody in the healthcare industry that there's a staffing crisis. It's in the news every single day. But what we're seeing in the healthcare industry is particularly difficult because you have the primary caregivers who are the women struggling to keep up with all the pressures that they're now under. And then you have the caregivers that are employed at the hospitals and the health systems and the clinics also leaving in droves. And so you have this two-sided problem happening here that is being felt especially in the healthcare systems. And then here in Arizona, this is particularly problematic because the health organizations are the largest employers here as well. So our economy is very much connected to the health of the healthcare systems. And so I like to think about this as like a holistic problem that is happening everywhere. We're seeing a lot of nurses leaving the field. We're seeing strikes happening. Anyway, the ability to actually service all of the folks that need the help, both on the call center side and on the delivery of care, is now more impacted than ever. Now, when I think about the continuum of care in this way, how are we thinking about people accessing care, which is where we usually think about like making a phone call or getting in touch with the health system to make an appointment. We have the actual delivery of care where we're providing the service, and then we have the ongoing sustenance of care, which is maybe making sure the follow-up visits are happening, the maintenance care, the medications are being taken, and people are being checked in with. So in all of these cases, what we have seen is the adoption of more technology to support this and to create more of a patient-centric approach, which is exactly what I love seeing, because as the consumer has more demands on their time and on their needs, especially women, they are going to need to have a lot more support with the delivery of care to their families and their family members. So a lot of us in the healthcare systems are thinking about, digital front door. We're thinking about, how do we make these touch points more user-friendly? How do we take advantage of technology to improve the delivery of care? And I like to think about, how do we help this mom who is now more stressed out than ever to make it easier for her to give her family the healthcare they need to get to their health appointments, to get to all of their follow-up visits, and make sure that they're not making their health situation worse at home because they can't take care of a chronic condition that maybe their child has. From a business standpoint, it makes sense as well, because we have to be thinking about, how are we driving acquisition of new patients? How are we realizing cost efficiencies? So, if we're making everybody make a phone call and wait on hold for, 20 minutes or 15 minutes, is that really the most cost-effective way of doing things? How are we retaining our patients? Are we making it so difficult to access us that they just go somewhere else or go nowhere at all? And then does our patient population have somewhere to go to actually get care if there's a chronic condition that's ongoing? And so all of these reasons are places where we can deliver better options from a digital standpoint. And what I'd like to share today are examples of how I'm seeing some different health organizations do this. So the first place that I like to think about, I always ask my health provider customers, like, where are you getting the most questions? And oftentimes they're getting a lot of questions, especially during COVID, related to records. So health records and vaccination records being one of them. And so I'd like to point your attention to this one company, STC Health. So they partner with state health departments, and they developed an application called MyIR. And MyIR stands for My Immunization Record. And so you can imagine that right now during COVID, there has been a lot of questions about immunization records, because many Employers are requesting immunization records, schools, venues. If you want to go to a concert or a basketball game, you were having to demonstrate and prove vaccination status. And unfortunately, just depending on where you got your vaccine, you may or may not have it all in one place on a card. You might have lost your card. Maybe you got one vaccine at Walgreens and another one at CVS. And so there's not a single place where all of your vaccination records are easily accessed. So the state health department becomes the single source of truth for this. And so my IR has actually worked with the state health departments to pull that data into an application so that people can just access it. And one of the things that they did that they found was they were getting flooded with phone calls. And so rather than having to staff up hundreds of people to answer the phones, what they did is they implemented a conversational AI that could answer everybody's questions about their vaccine records, get them what they needed. You know, we had a lot of parents trying to get their kids back into school or into childcare that needed vaccination records for not just COVID, but for everything. We had people trying to get back into work that needed to demonstrate vaccination status. We had families trying to manage, multiple family members' vaccines. And so they were able to use an AI chat solution to make this really easy and accessible 24/7, never have a single wait because this is all automated. Nobody ever had to even wait in a queue to get an answer about a vaccination question. So that was one really great example I saw. Another one is we all know that during COVID, we didn't just have a pandemic resulting from COVID-19, but we also had a co-occurring issue with a mental health crisis that also took place alongside COVID-19. And so behavioral health systems were really stretched during this time, and also struggling with long hold times and arriving at the office every morning and having 100 voicemails that had been left overnight. And it would take them 2 to 3 hours just to get through all the voicemails, let alone call all those people back, only to get their voicemails and then continue this never-ending cycle of phone tag. And so what I saw a lot of behavioral health providers do is turn to conversational AI in order to solve this problem. They're virtual agentless, virtual agents like this one that you hear, she was called Phoenix, was working 24/7 to answer questions from family members and individuals struggling with mental illness or with any kind of behavioral health issues, to get their question answers, get them connected up to a therapist, get them emergency counseling, intake them, identify if their insurance was even accepted by their programs, a whole number of needs they were able to support just using a conversational AI. And therefore being able to free up their phone lines for outbound calling instead of always being, bogged down with all of that coming in at the same time. So they were able to avert a crisis for their patient panel by making themselves more available using a virtual agent like Phoenix here. So very impressive. Another area where we saw a lot of movement and adoption of conversational AI was in senior health. So a lot of people will tell me like, oh, seniors, I don't think that they would use this technology. Why would a senior be interested in chatting or using a virtual agent? And actually, most of the health systems that are servicing the senior living population are usually dealing with a person, a woman in her 40s or 50s who's the daughter of one of the elderly patients. And so actually she's a digital first native, very comfortable with technology. She's asking questions about, facilities, insurance, care, and she wants to know if her mom or dad are going to be taken care of properly at a given facility, and is often doing her research at night after work, after putting the kids to bed. And so she has really appreciated having access to a 24/7 service like Benedictine, which is a senior health system based out of the Midwest, called Maria. And so Maria, she works 24/7. She never takes a break, and she helps families that are looking for a place that mom or dad can be safe and can get the care that they need, maybe after a fall or something like that has happened. So that's another example I love to share. And then finally, we're seeing a lot of community-based health systems, so federally qualified health centers who tend to be very value-based driven. They get their revenue streams based on, improving health outcomes with the patient population that they serve. And so they're especially motivated to make sure that nobody has to wait on hold to get the care that they need. And I'm seeing, these kinds of health systems be very, very forward thinking in terms of how they adopt technology. And in this case, Aspire Indiana, they created a virtual assistant called Ava, who is able to answer questions about services, can virtually schedule appointments for both in-office or virtual care, who can help answer billing questions, insurance questions, and even has been a driver for careers. Because we all know that staffing is an issue. So if there's somebody coming to their website that wants to know about careers, they want to also get as much information exchanged as possible and help any potential new hire also get in the door as quickly as they can. And they're even moving toward having their virtual agent support medication refills and pharmacy needs of their patient population as well. So I've given you a bunch of examples here just so you can see the breadth of the provider types that are using conversational AI and how specifically they're using it. But I'd like to drill down now into what's happening under the hood there, because I think that's probably why you're here. So here, and hopefully you can see this, I know it's a little bit tough to read. This is actually a conversation transcript of a behavioral health provider that was interacting with a client, a potential client that wanted to get treatment. And this person has come in, has mentioned what their concern is. They're struggling with borderline personality disorder. And they asked a very specific question, and I'm going to point to it here. The user, the client, talked about being a runner and wanting to know if that during treatment, she would be able to continue her running regime. And I'll say they, because I don't actually know if it's a he or she. They would be able to continue running. So that is a very specific question. And what I love about the way that this provider implemented AI is without the need of having a live agent, just using AI, they were able to answer that person specifically around their question, which is a very complicated question, and actually get them through the admissions process so that when the team arrived the next morning, they had already collected all the demographic information. They now understood the condition that this person was coming in for, and they were able to complete the admission, all without having to do a single phone call. And so they have been able to, apply a mature enough level of capability on this technology that they are now 24/7 doing admissions for complex needs. And how, now we'll go a layer deeper, like how exactly is this happening? How is the sausage being made? In this case, the user comes onto their website, takes it, asks a question or takes an action. And in this case, the provider has a couple of different kind of flows, depending on, are they asking for verification of benefits, which is a very common request. Do you take my insurance? Do you not? The AI service can automatically verify their insurance based on their plan number. They can go through and make sure that they have all of the information, the member ID, the location. And once those the verification of benefits results are captured, that data can then be sent into the profile of the client in the EHR or another system of record that might exist. Some companies are using a CRM plus type system like a Kipu, which has both a CRM and an EHR, or they might be using a very traditional EHR like a CareLogic or an Epic or something like that. And so the important thing is that not only is the data from the transcript captured and sent over, but then additional attributes such as the demographic information, the insurance information can all be appended to the record as well. So now we're also saving the step of not having to do manual entry in any way. So the interaction that happened over the AI chat is now automatically updating a record or creating a new record, depending on if that's a new patient or not, along with all the insurance information. And so this alone is not only reducing friction for the consumer or the health client, but also for the provider and reducing the burden on the front desk staff or the administrative staff to admit and to type up all this information manually. Now, there's another layer of sophistication here that we're seeing applied, and that's around analyzing the conversations themselves. And there's two ways that you can think about conversational analytics. You can think about it as kind of like a post-mortem on a conversation and seeing, okay, what was it that this person was asking about? How do we aggregate all the data across multiple conversations to be able to detect maybe new needs that are required? So for example, I know of one organization that they were also in the behavioral health space, primarily focused on drug and alcohol treatment, for example. And what they started noticing through the conversation transcripts and through the analytics that they were running, that they were getting a lot of questions about co-occurring disorders such as eating disorders. And that was a line of service that they did not offer. They did not have a lot of content around that or a lot of support. But noticing and analyzing the conversations that this was a need, they actually started to do a study on whether it would make sense to add treatment programs around eating disorders, and eventually did. And all of that was known only because they had this data popping up in the conversation analytics that they were running. Now, you know, a lot of people are using call recordings or something like that to handle the calls that are coming through to the administrative staff. But I have yet to see those kinds of themes served up in a way that a business team can actually make a decision so easily. So that's really something that this AI is allowing organizations to do, is determine, hey, maybe there's a new line of service that we could be offering to really support our patient population in a better way. We can also get an understanding what their experience or sentiment is about your brand. You know, how are they experiencing your services? Are they feeling good about them? Are they concerned about something? Are they getting the care that they need? Are they feeling confident in the care? And those are all insights that can be gathered through the conversations as well. And then there's also a need, you know, I hear often about is, hey, you know, we're a value-based system. We have to get people to be engaging with us, because if they're not engaging, they're not going to be getting the care that they need, and therefore we won't get our funding. And so they have to invest in some marketing campaigns and outreach or community outreach to really get people back in the door, get engaged, make sure they're refilling their medications, make sure that they're, you know, taking care of their diet, exercise programs, all of the different things that might go along with their treatment program. And so being able to collect first-party data directly from the consumer when they come into the chat is another very important reason, because now you can know, okay, this particular health consumer has these questions or these concerns, and we can actually put them into a campaign specifically around their needs, versus maybe person B that has a different set of questions or a different set of concerns. Maybe, you know, they see that Rebecca has young children, and so they're going to target me with campaigns that are more oriented around families with young children. But maybe there's another person who has seniors living in their household, so they're going to have a separate set of concerns. And so there should be more of a senior-oriented health campaign that they would be a part of. You know, I'm kind of simplifying it there, but the idea is that as you're chatting with these individuals through the conversational agents, these are the kinds of data points that can enrich the record and allow you to also do the appropriate outreach to those populations based on what you're collecting from them. And all of this can be done in a compliant fashion where, you know, the personal information can be anonymized, and what you're doing is just identifying a record or a number or some kind of ID to know that these individuals are going to be in these different campaigns. So here's an example of, you know, what happens when you don't have conversational analytics, and then what you can do if you do. So without it, you might be sitting on actionable data that you don't even know is there. I gave you the example of the line of service. I also saw another example where, you know, somebody was getting a lot of questions about skincare concerns. And so that presented an opportunity for a new product offering around skincare. So there might be some things like that that you're sitting on that actually unlock some revenue opportunities for the business. The other thing is that without the access to direct conversations with your patient population, with your clients, you might be missing out on the ability to, you're still very dependent on third-party data. So you might have become dependent on Google or Facebook or some of these other third-party platforms to give you data on a patient panel, and now those are no longer going to be available. So having first-party data becomes very important. And then ultimately, outcomes are what we like to think about. You know, the whole reason to have the ability to handle these conversations is not just to deliver a more frictionless experience for your health consumers and for your clients, but also to be able to find opportunities to improve the business, whether it's through efficiencies, through new revenue streams, maybe locations. We have a lot of people studying, where they should open up other locations, and conversational analytics can really delve into, where it would make sense and what lines of service to open up at those locations as well. I wanted to spend a little bit of time talking about sentiment analysis as well, because this is something that comes up often. And what we see is that, there's two ways that you can do sentiment analysis. You can do it after the fact, when somebody has completed a conversation, and you can study, say, okay, I want to look at the last 2 weeks of all the conversations that we handled. How did they go? Did people, have a good experience? Did they have a negative experience? And that's kind of I would say, the more traditional way that people are using sentiment analysis. There's now some improvements being made in technology and in kind of think of it as the compute that powers these AI engines that would allow sentiment analysis to happen in real time. And what real-time sentiment analysis allows you to do is actually to change the direction of a conversation depending on how an individual is presenting in the chat. So if somebody sounds like they're frustrated, or they're giving signals of negative sentiment, they might be directed in one path versus maybe somebody who is not. And this is probably the most, I would say, the more advanced use of sentiment analysis, to use it at runtime and then be able to modify the conversation flow, or even the routing of that particular individual depending on that. The other way that we're seeing it used is around emergency needs. And this is really important for anybody who has a patient panel that might be dealing with crisis at any point in time, but being able to detect possible self-harm, for example. And this is something that we really encourage used is in the chat. If somebody is in any way mentioning the possibility of self-harm, or not even mentioning it, but alluding to it, there needs to be a way to get that person to a crisis line, or encourage them to call 911 and get help, and try to de-escalate that situation. Very, very important. And this is something that often I see getting overlooked. So if you're running some kind of a chat in your system, go back and ask and make sure that you are running some kind of sentiment analysis to be able to see if somebody is in crisis or not, because that's something that we have seen a huge spike in recently, and that needs to be taken very seriously, as you can imagine. So, those are some ways. Sentiment analysis in real time is actually quite compute intense. And so oftentimes from an IT standpoint, it can be burdensome to try to do this. The great thing though is there's now some cloud services that are really oriented around this. And so, we can certainly point you in that direction if you would like. And then the last thing I wanted to mention was context. So context is really important. We use it a lot in human language. For example, if in this case, somebody comes in and says, hey, do you offer COVID tests? Yes, we offer COVID tests. Great. I'd like to book an appointment for that. When somebody says for that, they don't have to repeat COVID because you already mentioned it before. But most technologies have a hard time knowing that when you say that, you're referring to the COVID test, something that you mentioned maybe 2 or 3 utterances ago. So contextual responses are really important, being able to remember and retain something that a user said earlier in the chat, and then noticing that when they're referencing that again later using a word like that or again, or some other vague reference like that, that that they're actually talking about something that they had mentioned 2 or 3 utterances ago. So this is actually a very advanced capability in conversational AI. You're not seeing a lot of people quite using it fully yet, but it's actually the thing that makes it feel more natural and less robotic, is being able to use these kinds of contextual responses. There is a question here. What happens if there are different languages entered in the chat? So we think of language a lot like context as well. So if you have implemented a multilingual chat experience, you should be able to toggle between languages or kick off a process in the identified language. Here I'm seeing Arizona, of course, Spanish being a really important language to support. And in other markets, I'm seeing Vietnamese being really important as well, French, depending on where you might be. So thank you, Eric, for that question. It's a good one because it is really important to make sure that if you are servicing a population that is multilingual or that has a second language that's very prevalent, your chat experience needs to support it as well, because it doesn't do you, if you're trying to improve access, but you cut out a third or a fourth of your patient population because of a language barrier, then that's not terribly helpful either. All right. So anyway, I wanted to go through this, and we only have a few more minutes. So I'm actually going to go to my key takeaways here and then move into some questions. So, I hope I conveyed to you my own personal story of complexity in care and how hard it is for especially parents who maybe are navigating the health system for the first time, how hard it is to do this. And so we need help. Parents need help, families need help, health consumers need help navigating these systems. At the same time, our expectations are that the digital capabilities are really there. We're going to extrapolate our experience with Uber and Instacart and expect our health providers to offer something similar as well, to be available 24/7 whenever I need an answer about my health insurance, my health care, my appointment, a medication refill. All of these things we need to be supporting from a digital standpoint around the clock. We really see conversational AI as being, one of the main mechanisms for delivering this capability. And really catering to these digital first consumers. One thing to remember is that millennials are entering their 40s and they're going to be consuming a lot more healthcare than ever before. And they are a digital first population. And so making sure that our health systems are really set up to support that expectation is super important. Somebody here is asking a really good question about EHR integration. So thank you, Adil. That's a really important question. So when I was talking about that earlier, part of what's important in the conversation is knowing how to collect either demographic information, maybe there's healthcare related information about a person's condition or symptoms that need to be collected in the chat, or it might just show up in the chat. The person may offer these bits of information without even solicitation. But knowing that data has to get now inputted into the record is really important. And so, of course, if there's already an API available in your EHR, then that's a lot easier than if there isn't. So hopefully everybody here is moving toward a more modern API-oriented EHR, where data points like this that are collected, say in a chat system, can then be moved easily into the EHR and appended to that record. That's really, really important. There's also a bidirectional thought process on that, where there might be data from the EHR that needs to go into the chat. So it might be an appointment, it might be a reminder. These kinds of very important pieces of information have to go back and forth. And in that case, if you're sending patient data through the chat, of course, you have to do some authentication and make sure that the user is authenticated. But you can do all that stuff instead of sending them to the patient portal, which tends to have very low engagement in a lot of cases anyway. So I like to think about conversational experiences as kind of like a layer on top of the patient portal, where maybe you're getting the data from the patient portal, but you're not making them actually go into the patient portal. They can just chat naturally and get their questions answered as if they were talking to somebody, but they're just consuming the data from the EHR. And then last, I wanted to just put in a couple of plugs here about, how to get these initiatives organized in your company and in your organization, your health system. So, it's very important to have executive error cover, because anything that you do here is going to touch multiple organizations. You're going to have admissions involved, you're going to have informatics involved, you're going to have clinicians potentially involved, you have management, you have finance. I mean, all of these people, IT, who are going to want to have a say in how this gets implemented. And so usually trying to get buy-in from all those different stakeholders becomes impossible if you don't have executive cover, if this isn't coming from a board level initiative. So maybe the board isn't driving this particular implementation, but even if it's just a modernization of the digital experience, a theme around more consumer-centric delivery of care, maybe if you're tying it to an initiative like a value-based care initiative, those are all kinds of things that you can attach your initiative to get this through, because that's how you're going to need a lot of organizational support in order to make this happen. And then I have another question here about the skills needed to build a conversational AI team. So, this really depends, because there are platforms you can use that are very developer focused. So it will require having, people on your team that know Python, people on your team that are ontology experts that maybe have NLP engineering experience, and that can be a little bit daunting. So I actually don't recommend going that route. I always tell healthcare providers you should focus on delivering great care, not becoming experts in AI. Instead, there's a lot of really great commercially available products that have already done the legwork, where the PhDs of this world have already figured out these hard problems and can deliver to you a solution that is off the shelf, commercially supported, and that's going to require minimal technology effort, or no code is the ideal. So I would encourage you to maybe find more of a no code platform for doing this, where you're not going to have to implement a lot of code yourself or do a lot of heavy lifting from an engineering standpoint. That would be my recommendation. Maybe I'm biased, but that's the route I always tend to suggest, because resources are tight, and there's, if you can do something with 2 people versus 20 people, then I always think that that's a better way to go. But usually, the very least, you need a program manager or somebody who can help with the content and who can really help make all the connection points into the different systems of record. But you don't necessarily need to have an engineering skill set to do this anymore, because there are so many commercially available products to use instead. Great question. So thank you for asking that one. Anyway, with that, I wanted to make sure that everybody here had a chance to follow up with me if you had additional questions. I'm happy to share my deck. Somebody asked that question earlier. I'm going to see if I had missed any other questions here in the chat. Will the slides be available? Yes. And I think that covers most of the questions that got asked. But if something comes up after the fact that you didn't think about, my email address is available here, Clyde@Botco.ai. I'm also very active on LinkedIn, and I tend to post a lot of content there too. So if you have questions, you can reach out to me there. But thank you very much for having me here today, Tanya. It's been great to be part of this about the Arizona HIMSS chapter. I've had a chance to compare notes with a bunch of other chapters, and I think Arizona really is doing a great job by comparison. So kudos to you and the board there.
Yeah, thank you so much, Rebecca, for and everybody that joined us today. The content was awesome. Again, if you do have any additional questions for Rebecca, you can reach out to us at the at HIMSS, or reach out to her on LinkedIn as she provided. I do want to give another shout out to everyone. Don't forget to go to our HIMSS Arizona chapter website. Our next event is May 5th. And then our next webinar is May 19th. So check our website for those. And then don't miss our October, Friday the 14th annual health summit that is locked in right now. So those that information should be posted on our website shortly. So don't miss out on all of that. So we look forward to seeing you on May 5th for sure at the next event at Tempe Mission Palms.
Thank you, Tanya. Thanks everybody for being here today.
Thank you.